my name is Kristen Okopian. I'm one of the occupational therapists here at Muskegon Surgical Associates, and I work in the MSA Hand Center very closely with our hand surgeons, Dr. Ostrick and Dr. Terlouw. Today, I'm going to talk to you a little bit about what to expect in therapy for the first visit after having a distal radius fracture. So what this is a break in the part of the bone that's close to the wrist on the thumb side. Typically from a fall or sometimes a motor vehicle accident is usually what is how you sustain this injury. Typically for our first appointment, you should still have your post-op dressing on. This should not be removed until you see one of us in the office. We'll take that off, we'll clean you up, make sure everything is good, no signs of infection. There are two different ways that we can actually look at this, and this is dependent on what the surgeon decides in the operating room. Depending on the type of fracture, he may do plates and screws or he may do pins. With pins, we are going to go through and explain to you how to take care of these pin sites because that is very important for not sustaining an infection. And then with the plate and screws, it's a closed incision, and then we tell you how to take care of that. Also, we will take initial measurements for swelling, range of motion, your pain, sensation, and anything that you're having difficulty doing with surgery, and then goals that you have to get back to after surgery. We will initiate a home exercise program, which typically has to do with getting the fingers moving and the wrist and forearm guardedly. We will guide you through that on what you can and can't do safely with that. Also, what we will do is make you a custom splint, which will look very similar to this. So the idea with these splints is you can take it on and off, so it's nice to do your exercises, but it will allow free finger movement and it still blocks the wrist from doing any movement, so you can still be as functional as possible, but protecting the surgical site. Typically for therapy, we will see you 1 to 2 times a week, depending on how you're doing. And then overall with healing and everything, usually we will see people anywhere from 8 to 10 weeks, typically longer, unfortunately, if you have to be pinned, just because the pins usually will stay in 4 to 6 weeks first before we can even do much of anything with wrist movement. If you have any questions regarding therapy or what to expect further from what's answered in this video, please feel free to give us a call at 231-246-2440.